All right, so I'll show you how to treat these. So we're going to do some active release therapy. So we'll drop it off. So I'll do my own legs, so because you want to practice this with yourself. So we'll have it in a more neutral position with a pillow underneath here first. Okay, so the muscle's nice and relaxed, and then we're going to put it on more and more stretch. Okay, and you do this the same with your clients. All right, so I'll start off without any cream or any oil, any lubricant. So remember, we want to be in around here. You should be able to feel those bands as you come into there, okay? So in fact, I'm going to use a bigger cup. Nice strong suction. Right, now there we go. So again, I'm just using this technique to test the fascia. I get more pressure there. So just experimenting through here. Okay, I'm going to really get some good strong pressure on this. There we go. Right, so if I did this, and it's tighter, and it is tighter this side, I'm going to just lift and turn and hold that torsion to see if we get more release. Okay, so after a while these tissues will release. So again, this is just in your therapeutic toolbox of cupping, another technique that you can use. So try and get it. See, there's a lot more restriction in this direction. So again, I just pull, turn and hold as we work that. And you feel it release, and you keep rotating until you get a better balance. Okay, so that's one technique. Of course, you know the other techniques you can use. We can really do some lovely work around the clock face here. Other direction. Okay, so of course you can do all the techniques that I've showed you, north, south, east, west. We can do some really nice pulling work here. If I just hold this, see if we get it to do some nice myofascial work along here. So we're right on top of these trigger points. So so this is really strong. It's not painful for me. You see it's just dragging ever so slowly to get that myofascial release. Working on top of those trigger points. So remember, there's trigger points up here. As we get up further, there's more trigger points up here, referring along, so some of the ITB, iliotibial band syndrome. So if I just anchor there, get this beautiful, beautiful pulling release. So that is a lovely way to really work these. So if I just use this, so again, we could use with cream, and I'll show you in a minute, lubricant. But if I was to do this and then now put it into a more, if we bend the knee, so it's a more lengthened position, I might have to come down. I'm not sure I see it. I'll try with the big one. So now we've got the muscle on more of a stretch, okay? So we've got various options. So I could just do this like this. Obviously, I could just do exactly the same work I did. So you could go back. So we did the up and down volume here. You could just use that technique and now do it here in a more lengthened position. So what we're doing is any of these techniques you can use, right? So you might find some that you just like to use better, you get better results. So if I even now I'm bending my leg even more, and we could just do that same technique throughout range. So we started up here in a neutral position, a more contracted position, relaxed, and now we start to lengthen the muscle as we go. And again, you can do myofascial release work without lubricant like I'm doing now, but let's put some lubricant on. We'll do the same type of treatment. But we'll now start working with some lubricants, okay? So I'll just put some oil down here. So maybe you started like that, did that work there, And now you want to do some more broad work. So I think we'll go for a smaller cup. And here we go. So let's see here. So we're right on top of those trigger points. I'm going to go for more strength because I really like this along the side of my leg. Feels really releasing, really good. We go down over the iliotibial band. And of course the vastus lateralis over here, addressing those other trigger points. Going along it. So you can see the vastus lateralis. When I pull on this iliotibial band here in vastus, you can see the sort of the muscle, the vastus lateralis, and there we've got the IT band there. So lift, going along, and now we could do some extra work, just nice shaking work right on top of those trigger points. And we can move it along. You see that? And of course, just going to get some more, I really like it strong through here. So all directions, and if you feel that granular tissue, see how we can get really strong here. Again, this is not uncomfortable for me, but you can see how much suction's in there. It's like, it's really nice. So of course, work all through the thigh and just put your focus on those trigger points, as you can see. Oh, God, it feels just so, it really feels good. So work up rectus femoris, all these attachments by the knee. So I'm doing this on myself so it's easier. Yeah, so you can, don't give your clients all the love. You've got to do your work on yourself. So I'm going to just keep that strength. Now put it into a more lengthened position of the muscle, which is going to make this stronger for me. So just again, make sure you're not uncomfortable. And if I bend my knee even further, again, you'd be doing this with your client like this, to work this muscle in a more lengthened position. And of course, you'd work the whole leg. Be careful on the medial side, it's going to be more sensitive. But you can see how wonderful this is. And hopefully, if you're doing this at home, feel how wonderful that is as well. All right. So, lateral knee pain, vastus lateralis. You work along these trigger points a little further along. It's going to be more about related up along here more, and the points up here, we're going to be more around this hip area. Okay.